everyone, and welcome to the second episode of AMSP series, Talkie. In this series, we tackle certain topics in line with the Department of Health's 2024 monthly health celebrations featuring medical experts from Alpha Mu Sigma Phi as they provide insights into their respective fields. I'm your host, 𝗗𝗢𝗞𝗘.
And I'm Dominic Bourbon, and today we're joined by one of our special guests, Dr. Kathleen Garlito. She's a resident at the Department of Psychiatry Center for Behavioral Sciences at the Vicente Soto Memorial Medical Center. She was a graduate of CIM Batch 2013, AMSP Batch 2010. She's currently in the Vicente Soto Memorial Hospital, where she also did her PGI-ship in 2014. She was a military doctor from the Armed Forces of the Philippines 2015 to 2020.
And we not only have one, but two Alpha doctors here with us today. I would also like to welcome Dr. Odyssey Key. She is a company health physician of Healthway Medical Clinics. She is from AMSP Batch 2020, CIM Batch 2022, and DOH East Avenue Medical Center PGI 2023. Thank you so much for being here with us, Doc. I'm so excited to delve into the topic that is an issue that we all have been affected by, and that is burnout.
So how are you guys today? Kira,
How are you?
how was your flight?
I'm fine. I think I need coffee.
For sure.
Yeah.
From Dr. Coffee. How was your drive, Doc?
It was fine, but thank you for having us.
Yeah.
Thank you for this opportunity to talk with young minds.
So we're definitely glad to have you here. So without further ado, let's dive right into the topic. So the topic is burnout. So let's get things straight. What exactly is burnout and how does it manifest in our lives to begin with?
So burnout is exhaustion brought about by current stress. So it is an imbalance between empathy and self-compassion. So there are different signs, but not limited to burnout. So there are times when you no longer enjoy what you're doing, or you want to isolate yourself from others, or you feel detached. But it does not necessarily mean that if you feel this way, you are burned out. It could be another signs, but mostly that is what you have to look out for if you want to know if you're already burned out.
You know what? I think I might be burnt out.
It's hard.
Based off of that. So yeah, I relate. How about you, Trish?
I think this is something that I think most of our peers struggle with. I definitely had to deal with this in college prior to med school, and especially more so now that we're studying a lot more in med school and we have to study for hours every day. So I think this is very
relatable.
Giving.
With that being said, Dr. Key, what do you think are signs to watch out for regarding burnout?
Doc Kath already said kanina, like some of like the summary of what are the signs for burnout. But number one would be really exhaustion, like that kind of tiredness na murag kasabot, like you're just really tired of doing anything at all, like even moving a muscle, getting up from your bed and not explaining why you're so tired. Even eating is tired, like everything that you do seems tiring. And number two would be cynicism. I read na when you're cynical about things, like everything is so negative, like it seems like no positive thing will go in your way. Parang every minor inconvenience is too much for you, like kakapuya oy walay grab, and then we're break down na kapadong, like basically like minor inconvenience in your life, and you feel like that's already the end of your day for you. And number three would be feeling of uselessness, like no matter what you do, it feels like it's still not enough. Especially we can relate in ACADS, right? Like as med students, because me, I just recently graduated, and then it feels like med school is still fresh for me. PLE is still fresh for me. It's the most hardest part of my life. Would you agree on that, Doc? Even if like you give your all in your daily, wala gyapon, useless gyapon kay your score doesn't manifest. Especially in way back PLE, like we have practice tests, so that's how we gauge our like parang our parang Tagalog. Like our progress.
Yeah.
Like even if you know na you studied so much in that and it doesn't reflect in your score. So it feels like, why am I still doing this? Like you feel useless in your drive into pushing your goals every day. But then again, another thing as well that I can say na burned out na ka is like it's in your mood, like you're irritable, like yeah. Well, it kind of relates to those like minor inconveniences kanina na murag gamay ra na ano mo sprak na ka.
How about you, Doc Garlito? Like, do you have any other signs that you could point out or mga triggers that could like lead to burnout?
So, as what Doc Odyssey said, no, minor inconveniences, and then when your goal or your work does not resonate to your goal, so when it makes you frustrated, it makes you think twice that why am I doing this in the first place? Am I doing the right thing? Is this the right thing to do, or why am I really here? It stems from a series of stress that you cannot cope up, or you are not in control of the situation. Most of the times when it does not go according to what you planned or what you wanted, that's when you eventually develop to burn out. So an experience, let's go not far away, because med school was very far from me na, no? I graduated 2013, so it's more than a decade. So I worked in the military before, and then we are on call 24/7. So that means you are away from your family. So I was assigned in Cavite. I have been assigned in Zamboanga. So you are on call 24/7 and you are confined in a place alone. You are isolated. So if you have concerns, it's very difficult to find someone who you can talk to about it. And then you felt like everything is overwhelming. And then you see on your work. So I felt that I am not living at, or I'm not working on my optimum. I do commit errors. Yeah. So that's, for physicians, we will be physicians in the future, very important that you know what burnout is and when you have it, because it translates to what you give to your patients. So I have noticed that this is not good. I am giving medication errors.
This is not me. Like,
yes.
Parang this is not my prime.
Yeah. So that's very important. You listen to your body.
I think, Doc, that also comes in like when you feel that feeling. It's like there's a sense of like diminished pride in your work and in what you do, because like, yeah, like the feeling of like uselessness still. And with that being said, of what you said during like the healthcare setup, like I think doctors and the people who work in healthcare are like more prone to burnout, because like it's an encompassing kind of job. So like you not only do medical stuff, but also you have to see the patient as a whole. You're not only gonna talk to the patient, but also like to the family, and it takes so much from you as well. And like imagine if you just give and then parang wala nang mabilin ba sa imuha. So so important. And that makes me realize as well that healthcare burnout is also different from like med school burnout.
Yes.
Like when you become once you become licensed physicians in the future, makasay mo na the burnout in med school is also hard, but the burnout in when you already work is a different kind of dragon that you have also to tackle. Like you're given more responsibilities because you're not only caring for yourself and your mental health, but like also your patients, like you're already dealing with their lives. So yeah.
I have a question actually. So how do you differentiate burnout from other disorders or like other syndromes? Because some of the signs that you guys mentioned earlier, it kind of sounds like maybe like depression.
Yeah.
You know, so like, how do I differentiate? Like, am I burnt out, or do I need to like go see a psychiatrist?
So being burnt out can be a risk factor to develop eventually into a mental health disorder. So that's why it's very beneficial as early as now, when you are still med students, you can identify the signs of burnout so that you could be able to address it right away. Because eventually, if you won't be able to address it, that's the time these depression comes in, no? So with depression or other mental health disorder, there is a time frame. In psychiatry, we don't say that because this person experienced this, depression dayon. So it takes time. So there is really a reason, or it could be a confounding factor. There could be confounding factors why this person developed depression. So it's very nice that Alpha Mu is able to communicate and inform other alphans what are the signs of burnout so that we could already address it. So as early as now, as what Doc Oddie said, it would be a different scenario when you will be doctors in the future. As early as now, when you are still med students, you develop coping mechanisms or you develop things that could help you with burnout. As they say, you cannot give what you don't have. So you cannot give your time if you yourself is not okay. No? You are not in tune to helping other people if you yourself has difficulty helping yourself. So with your question, how can we differentiate it? So basing when you say I feel tired, maybe this is depression na, no?
Yeah.
So time. There is a time frame, and also with depression, it is not only the feeling of fatigue, it is not only the feeling of sadness, but there are other symptoms that you have to comply. If you comply the number of symptoms, no, if you complied with the number of time frame, then you can have the mental health disorder. But basically, when you know that you are already having the signs of burnout, like fatigue, no, headaches, you can address it right away.
Sometimes, but doc, burnout can also like manifest physically, right?
Yes, yes, very much. When you feel like you're having headaches most of the time, or you feel like you're tired all the time.
Like headaches that won't go away. I have like a friend, like, I'm not saying that he's burnout, but like he has like an upcoming test ba, and then he always like kanang loose watery stools, diarrhea, and then he thought that he has infection and like nagpa-stool exam and everything, but like he's all cleared, but it happened to be like stress-induced diarrhea. So like yeah. like I was like, oh, it's real, because like clear iyahang fecalysis and everything, and then when he took a time off into studying, because like he's gonna migrate soon, so he's like preparing for a big test. When he took a time off into studying, nawala yung diarrhea. So like it's really something na sometimes like we're like oblivious or like in denial of the things that we feel, but it's really already signs of burnout.
Thank you so much for that. So we actually have a bit of a twist, no? So we asked CIM students some questions that they had about this topic. So in this bowl, we have those questions, and we're gonna ask you guys to draw a question, and then we're gonna ask you to answer it. So for the first one, Dokie, okay, can you please draw?
Thank you so much, Doc Oddie. Our question for you, Doc, is for those who are starting to feel the effects of burnout, what steps can they take to begin their recovery?
Thank you for the wonderful question. I think the most important step is like accepting, like realizing it that you're going through that, because like you wouldn't really recover from something if like you don't know that you're really going through that something. I mean, I'm not telling you na, oh, I see those signs, maybe I'm burnout na. You can reevaluate yourself first, like, am I really like burnout? Because like it's not just because of the signs, you also know by yourself man sad if kapoy na gyud ka, diba? Like if you really burn out. Because like if you parang use that word lightly na I'm burnout, or gamay ra kaayo na burnout na dain ka, diba? That also manifests in how you deal with your everyday situation. Like you can also say na, I can't do this, kay burnout naman ko. But honestly, like you can still push yourself. So that one, acceptance. And number two would be if you really know na I really pushed myself na this was really my limit na, like wala na gyud ko makagive. Like I think that's the time that you should detach. Like you detach from the situation, because like I think the best way to cure a burnout is to really like pause and reflect. Diba, burnout is really like prone if you're doing a lot of stuff. Like, for example, you're a med student, you're still doing this podcast. You also have like social life, you also have family life, you also have school works and whatever, like napamoy clerkship and everything. But like, it's so overwhelming to the point na you don't know what to prioritize. Me, when I reached that point, like it's so ancient for me to do, but I really do a journal. Like I really write it down, because when I write it down in a piece of paper, like that's also like a therapy in a sense na I reflect ba while I write it. Because like if you chat lali ra ka diba, it takes like faster lang, but when you write it kay it takes time. So when you're taking time on writing it, that's also like a pause na for you. For example, I'm presented with a problem, and then, for example, di ka katulog, di ba, burnout sad, like, you have a lot of problems before you sleep. I write it down as well, and I stop thinking about that problem if I already have a solution. Because, like, what's the sense of me, like, overthinking pa about the problem when I already have a solution na? Then I tell myself na, okay, stop thinking about that now, because there's nothing you can do. What you can do now is just sleep. Tomorrow na siya. So when I have the solution na, that's when I tackle the problem. So wrap up, acceptance, detachment, and then stop thinking. Stop thinking.
I want to do that all the time.
Like stop thinking. Because you're so overwhelmed. Like why do you have to think pa? Stop thinking lang sa for a while. And just do something that's unrelated to the thing that's causing your burnout.
I want to stop thinking. Period.
I think that would solve a lot of problems.
Yeah, all of the problems. So really, that was really helpful, Doc, Audie. So for the next question, Doc, will have you draw from the bowl.
So the $1,000,000 question.
The $1,000,000 question is, how can workplaces or educational institutions play a role in preventing burnout among their employees or students?
So the employers and educational institutions play a big role, because basically they are some of the source of burnout. No? So it is very important that they cater on an environment that is safe for the employee or safe for the student, and somewhere where it is judgment free. No? So let's take an example, our institution. Currently, we have a wellness center or wellness room wherein the resident, if everything feels so overwhelming, they can pause and take a breather, even if it would just be 15 minutes, 30 minutes. We are given the most 2 hours so that you can pause. No? There's nothing wrong with pausing, no? As what Doc Audie said, stop thinking for a while so that it could give you another perspective. Because when you pause, you are not confined to what you are seeing. It makes you look at things at a bigger point of view. If the employee or the student is burnt out, give them a breather. I could remember when we were in med school, every bi-monthly we are given an activity. Do you still practice it now?
Activity?
Yeah.
Exam?
No, activity. So that's after the exam. So on the first part, we were taught. However, towards the end, kami na ang mag-volunteer sa among self. So you think, unsa ato activity now? But we are given options like what would you want to go after the monthlies. So there is a break. It is not compulsory, but we are inviting who wants to go karting or who wants to go wall climbing. And then eventually we develop that, after the bi-monthly exam, we will go to this place and we will have a get-together. So it is very important to maintain a work-life balance either in the workplace or at school. Because the person, as we know in medicine, we treat the person holistically. So this person has a role being an employee or being a student, but we should also take care of the mental health side or the other concerns of the patient. So it is very important to take a break if you need to. In our institution, we are provided with a environment that is safe and also an environment that is friendly and an environment where you can rest if you are overwhelmed or you are tired.
So actually, talking about like the interventions that institutions make, we're actually celebrating Mental Health Month this month. So that's one of the reasons why we're having this podcast. So thank you so much for your answer, Doc.
Yeah, I think it was like really nice hearing that a lot more institutions are trying to integrate more wellness options for their residents, and I know CIM celebrates Mental Health Month, so they also like to set apart a day for us to kind of just have us have a more well-rounded
It's a
month,
week.
I guess.
It's a week.
It's a week. Oh, it's a week.
It's a week.
But thank you so much, Doc. And our last question for both of our beautiful doctors is, what advice would you give to our listeners who want to protect their mental health and avoid burnout?
So first, listen to your body. So if you feel tired or you feel like you're having body pains or this is not the usual you, then your body is telling you something. So you listen to your body and always practice self-care. No? Because as what I've said earlier, you can't give what you don't have. So you have to make sure that you are ready. No? As a med student, you have to make sure that although you know your goals, but you have to make sure that you are equipped. If you feel like everything is overwhelming, it's very okay to pause or to stop for a while. You can have activities like, for example, it could be very simple, like sipping a cup of coffee. Could be very cathartic, no? So for example, you enjoy coffee every morning. So you take time to sip that coffee, enjoy the aroma of the coffee, and at least it gives you a different perspective or a different point of view. At least during that time, you rest so that you can be ready for another day ahead. You can make it a habit. You can do this at the same time every morning. At least if you make it a habit, every time you feel stressed or every time you feel burnout, you can remember, I do this to make me feel relaxed. No? It doesn't mean that you always need to have a coffee. You can do it with ice cream or a soup during the rainy days. So let's always remember why we are doing this. So if you are a student, why you wanted to study medicine, so that you can go back to the reason why you wanted to experience all this, like studying, no? It's very tiring, but at the end of the day, if you know that why you're doing this is for my future patients or this is for me, it keeps you grounded. And but in the process, don't lose yourself. Always listen to yourself and practice self-care.
Thank you so much for that. It reminds me bitaw of kanang, I'm not sure if this is the right term, but like mindfulness and just being like present, no? Like especially like the ritual and like the cup of coffee. I do that every morning, Mansan. But just like activating all of your senses and like really taking it in, and I really
think
like that.
a great way that like our Gen Z likes to think about it is like romanticizing your life.
Yeah, that's
So,
the way
like,
to put it.
yeah.
Cloud
Like-
chasing. Go chasing your own life.
Yeah, like
That could be a thing.
time to like really
Yeah.
enjoy the little moments and ground
Yeah.
yourself.
Yeah. How about you, Doc? Key, like avoidance or prevention, in like to begin with. How do we not get burnt out?
I think for me, my personality is really prone to burnout. Why? Because like I'm extroverted. I do a lot of stuff. Murag, di ko mapakali if I don't do something. So that's prone to burnout because sometimes if you're a jack of all trades, you don't really know. You just keep on doing stuff. So lately, I've been practicing this year because I'm doing my moonlight year, diba? It's been really nice for me because I learned more about myself. And then this year, I've been practicing to learn how to say no. Because in my whole life, I've been saying, yes, okay, go, let's go here, yay, let's go here. I can do this, yes, I can lead this, I can organize this. Because aside from med school before, I had APMC, I also had a podcast in APMC. It's called Tell Med About It. And then I was talking to a lot of like people like schools ba in Visayas. Like I was the health policy coordinator. So basically, I did a lot of stuff. So it was exhausting for me. Now it was my year to say no. Like it's for myself lang sa. Like it also reminds me of what Doc said. Aside from learning how to say no because of my personality that I'm always saying yes, I like what you said, Doc, regarding about being grounded and having like a moral compass, because like at the end of the day, we get tired, yes, but like if we have a reason, like a really strong reason why we're doing this, med school, residency, work, being a doctor, and a lot of stuff, even not being a doctor, like doing stuff like if you're in media, if you're in other business industry, like why you're doing that in the first place will kanang make you grounded bitaw. Especially in med school, you really need that, because if you don't have a why, you will never know the how. If you don't have a why, that's when you start really asking yourself like, am I really in the right place? Yeah. Because like it's not the end of your life if you can say na, I can change career, or like because I don't have a reason, like a strong reason why I'm here. Like why are you doing that to yourself? Like why are you kanang suffering pa if wala kay stronger reason nga nung you're still there? Like that's why as well, Murag, I took the moonlight year because I want to gather all my whys. So that when I enter residency in the future, I can say na, oh, you already know your whys. Like, these are your whys, and you already done a lot na. You already prioritize yourself in those pause years. So like, unsa pa man imong giyon sa nganong nagpakapoy-kapoy man ka diha na humana man kaog rest. So this is your time now to execute your why.
I also really like that thing about like learning to say no.
Yeah.
Yeah.
I think you can relate.
Yeah, because I say yes to everything, but something that I cannot say no to is a good cup of coffee from Dr. Coffee.
Yeah.
Our sponsors for today. This is where we're shooting our podcast. So our very beautiful facilities, Dr. Coffee.
Hi guys! In celebration of National Mental Health Awareness Month, we just wanted to say hi and talk about something that a lot of us experience, especially these days, especially us as creatives. And it's called burnout.
Yeah. So, have you ever been burnt out before?
Siyempre, feeling ko lahat tayo, hindi lang creatives, di ba? In all fields. Especially if we're so in it, super into it. Yeah, susceptible tayo to
So, what do you do when you're burnt out?
I burn, just kidding. Baduy. Usually I will take a break talaga, take myself out of that situation and kind of go back to the reason why we're doing things. Kasi sometimes we get so lost in the day-to-day or like the process of doing it na parang nakalimutan natin yung reason behind. So taking a break, finding a different environment really helps me ground myself again. How about you, love?
I just feel like I take account of what I'm grateful for. I take account of why I am doing this, who I am doing this for. For example, the kid in the back na medyo maingay.
That's life.
Yeah. So once you ground it in purpose and know that kailangan i-balance pa rin talaga with rest and family and work and all these other things, that it has to be cohesive and with your goals. Mas napupush through natin yung mga stressful situations. So, I would say that is how I do it.
Yeah, but I just want you guys to know that if you guys are dealing with burnout, it's completely normal. Hindi kayo alone, hindi kayo nag-iisa. Lahat tayo.
Lahat tayo, kahit sino.
Yeah, lahat tayo. So, push through it lang and know that you're not alone and that you can do this. One step at a time lang. Bye!
So thank you so much, Dr. Kathleen Garlito and Dr. Odyssey Key, for being here. I've learned so much. I'll see if I can implement it into my life. How about you, Trish?
Yeah, I think it's really comforting to hear that with experiencing burnout in med school, like knowing our older mentors who looking at where they're at right now, like being so successful in our eyes, like that they've also been through this struggle and they're also going through it. So I think it's comforting to know that we're all doing this together in a way.
Thank you so much to our listeners for tuning in to our second episode of Talkie. If you haven't already, please do watch our first episode on our channel. It's about lung health, and subscribe if you haven't already. So we hope today you learned a lot about recognizing, understanding, and preventing burnout. And remember to mind your mind and shape your safe spaces.
And as always, Alpha Mu Sigma Phi.
Proud to be. This video was sponsored by Dr. Coffee.
I like the way